Well, back home now, and most of us are pretty familiar with the Slip, Slop, Slap campaign. And yes, Australia has one of the highest rates of skin cancer in the world. 2 in 3 Australians will be diagnosed with some form of skin cancer before the age of 70.
Now, most of the cases could be successfully treated if detected early, but the expensive skin tests often mean they're not a priority. Well, joining us now is Dr. Scott John Maggs of the non-profit charity Skin Check Champions. Thank you so much for coming in and chatting with us this morning.
Absolute pleasure, thank you.
All right, so let's talk about the cost here. And is that why it's not a priority? What is the cost of a skin test? And is it covered by Medicare?
So currently skin checks are covered as a general consult under Medicare, so I think it's around $38 to $40 you get back. And unfortunately, that amount of money doesn't cover a lot of the time that doctors need to do a proper skin check. So it's tricky because all these people are kind of knocking on GPs' doors wanting to get a skin check, which is amazing, but the economics of it is a bit tricky for them to kind of handle that much demand. So a lot of them are forced to charge, and that leaves a large portion of the population out, and it's a bit of a tricky kind of problem to solve. So we're hopefully going to try and help do something.
So that stat there, Scott, 2 in 3 Australians will have some form of skin cancer before the age of 70. What are the ramifications for those people who either can't get in to see a skin doctor, a dermatologist, or don't have the cash nor the time to do it?
So skin cancer is one of the most cheapest and easiest cancers to treat if it's found early. And over 98% of the time, if you get onto it, you can do something about it, which is what our charity is all about. But if it's left late, it can really go downhill very quickly. And once melanoma is in your system, it can kind of migrate and pop up anywhere and cause all kinds of chaos. So early detection is such a vital piece of the puzzle. And yeah, for a lot of, there's some amazing treatment work going on, and we're leading the world in treatment in this country.
With the Melanoma Institute.
It's phenomenal. Yeah, so there's some incredible work going on in that place, but still, if people don't know about a problem, they can't do anything about it.
Yeah, yeah. But your petition, now you've started a petition for a more targeted national skin check program. That petition is now closed. Where do you go from here with that?
Yeah,
what are you trying to achieve with it?
Thanks to everyone who signed. We managed to get in the top 7 of 85 online petitions, which was amazing. And so this is a formal petition which is with the House of Reps, and that will be read out in their next sitting and then referred to the health ministers with urgency, ideally, for a response. But basically it was a way of formally pushing this issue further into the public sphere, which I believe definitely needs to be done. And I think now this needs to be done more than ever, is because with the current technology and talent mix that we've been working with and that's happening in the country now, I think this is finally in the realm of possibility that we can get this program up.
What is the program? What are you trying to achieve with this permission? I mean, we know that we've got, breast checks, bowel checks, cervical cancer checks, but there is no strategy for skin checks?
No, that's right. And it's been discussed for decades, and I think we met with the Minister for Health a while ago, and he said it's the holy grail of cancer screening. And basically, all of the models previously suggested have been too expensive in terms of per check, and they haven't found enough skin cancer per 100 people to warrant the investment. So what we've been working on for over a decade, we've done over 12,000 screenings now, targeting high-risk communities. We believe that ratio is a lot more efficient, so our kind of ROI is around 28 to 1. So for every $1 spent, it returns 28 back in healthcare savings. And our detection rate is around 1 in 30, and even more in those really high-risk remote regions. So hopefully, we've just completed a research project called Project Checkmate, and basically our model uses nurses, training nurses in regional areas, so we're not just visiting and leaving and then abandoning the kind of community. So we're increasing capacity, and we're also using AI, which has never been available before. So we believe with this mix, we can really present a strong case for a good quality screening program.
This screening program, obviously, very important for people in rural and regional areas where health infrastructure, well, it's very difficult to get access to it.
It's so hard. And the GPs, bless them, like they're doing such a big job out there, and all of the healthcare networks and the nurses and specialists in those areas are really kind of doing their best with what they've got. But skin cancer is one of those things that just kind of falls off people's to-do lists, and even more so when you don't have access to people who can do the screenings. And some people, like we did a skin check in Cooper PD a while ago, and people were driving 4 hours from their stations to come and get checked. Like people are travelling hours, if not days, to come and get. We did one in Uluru, and people were driving all the way from Alice Springs and further out to come and get checked. It's like they need it, and they know they need it, but they just don't have the opportunity.
So the demand is there. The House of Reps obviously sits again next year, so we'd love to stay in touch to hear how that all goes. Scott John Maggs, thank you so much for joining us.
Thanks so much.